Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hydrothermal Endometrial Ablation. Introduction. A hydrothermal endometrial ablation, also known as HTA, is a procedure that allows healthcare providers to destroy the inner lining of the uterus. It is one way to treat women who experience too much menstrual bleeding or if menstrual bleeding is irregular. Your healthcare provider may recommend that you have an HTA. The decision whether or not to have this procedure is yours. This program will help you understand the benefits and risks of hydrothermal endometrial ablation. It covers the indications, benefits, alternative treatments, risks, and what to expect after the procedure. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. These organs are located in the pelvis between the urinary bladder and the rectum. The main functions of the ovaries are to release hormones and release eggs. The ovaries' main hormones are called estrogen and progesterone. The ovaries release eggs needed for reproduction every month. This is known as ovulation. The hormones estrogen and progesterone help to control the cycle of ovulation. Estrogen and progesterone also prepare the inner lining of the uterus for pregnancy. When the ovaries release an egg, it travels through the fallopian tube to the uterus, where it can be fertilized. If the egg becomes fertilized, it will attach itself to the lining of the uterus. The uterine lining becomes thicker in case the egg is fertilized. The inner lining of the uterus is called the endometrium. If an egg is not fertilized, the body sheds it with the thick inner lining of the uterus. The body gets rid of the extra tissues and egg through the vagina. This process is commonly known as the menstrual period. In time, the ovaries quit producing hormones and releasing eggs completely. This is known as menopause. The lowest part of the uterus is called the cervix. The cervix leads to the vagina. The vagina is a canal that leads to the outside of the body. Symptoms and their causes. Uterine bleeding is a condition where more blood comes out of the vagina than normal. Uterine bleeding can interfere with a person's social life and daily activities. Uterine bleeding can also cause bad health side effects like anemia or weakness. Most women have regular periods with bleeding that lasts about 4 to 5 days every 28 days. Some women have irregular periods, or periods that last a long time with heavy blood flow. When a period lasts a long time with heavy bleeding, it is known as menorrhagia. Heavy periods can cause you to lose a large amount of blood. Intense cramping and abdominal discomfort often happens with menorrhagia. There are many reasons for unusually heavy menstrual bleeding, including some of the following conditions. Hormonal imbalances can cause unusual bleeding, especially around menopause. Benign or non-cancerous tumors can also cause excessive bleeding. These tumors are known as fibroid tumors. They are located in the muscular layer of the uterus and can grow to a very large size, causing cramping and pain. They can also put pressure on nearby organs. Parts of the inner lining of the uterus or endometrium may sprout out, becoming as large as a grape and hang inside the uterus. These are called polyps. Polyps can cause abnormal bleeding. Cancers involving the uterine lining can cause abnormal bleeding. Abnormal bleeding can be caused by a uterine septum. A uterine septum is a condition where the uterus is divided on the inside into sections by extra tissue. The tissue dividing the uterus may have to be removed surgically. Sometimes the inside of the uterus can develop scar tissue. This tissue can cause a lot of bleeding, irregular periods, and even make pregnancy impossible. The inner lining of the uterus can grow into the middle muscular layer of the uterus. This is known as adenomyosis. Adenomyosis causes pain, cramping, and abnormal bleeding. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Treatment options. Your gynecologist will do an examination, run some blood tests, and may even do an ultrasound to try to find out the reason for your abnormal bleeding. If the uterine bleeding is caused by a hormonal imbalance, your healthcare provider may suggest you take birth control pills or progesterone. You may be also asked to do a hysteroscopy. A hysteroscopy is a test where a scope is inserted inside the uterus. This allows your healthcare provider to get a better look at the uterus and to make sure there are no other problems. This test is often performed at the same time as an HTA. If after the hysteroscopy your healthcare provider is unable to find and treat the reason for your bleeding problem, he or she may perform an HTA. An HTA is a procedure created to destroy the endometrium, the inner lining of the uterus. In most cases, HTA decreases heavy and irregular bleeding. Sometimes it can stop the bleeding completely. There are many procedures for endometrial ablation. Options include electrosurgery, cryoablation, hydrothermal, microwave, radiofrequency. This module describes hydrothermal endometrial ablation. Before the procedure. Because this procedure aims at getting rid of the endometrium, future pregnancies are usually not possible. If they occur, these pregnancies often end in miscarriage and cause a risk to the mother and baby. For these reasons, some patients opt to have a sterilization procedure at the time of the endometrial ablation. Discuss your options with your doctor. Tell your gynecologist if you have any allergies, including allergies to drugs, food, and substances like latex. Also tell your healthcare provider if you have any medical conditions, such as previous operations, heart trouble, breathing difficulties, and previous infections. Make sure your healthcare provider knows all the medications you are taking. This includes all prescriptions, over-the-counter medicines, and any supplemental or herbal medicines. Make sure to tell your healthcare provider whether you could be pregnant. Your gynecologist may give you some medications. This is to help your uterus get ready for the operation. Procedure. During HTA, heated water is flushed with controlled pressure inside the uterus. This permanently removes the tissue of the endometrium by burning it. This procedure is usually done in a hospital or in a surgery center setting under general anesthesia. This means you will be put into a deep sleep and feel no pain. It is an outpatient procedure, which means you will go home the same day. The procedure usually takes about an hour. Before starting the HTA procedure, your gynecologist will perform a hysteroscopy. During a hysteroscopy, a scope is inserted inside the uterus so the healthcare provider can get a closer look at the uterus. During the procedure, your feet will be placed in stirrups. The vaginal area is then cleaned to prevent infections. A speculum is inserted into the vagina. A speculum is a tool that helps your healthcare provider keep the vagina open during the procedure. This is usually not painful, but it can be uncomfortable. You can reduce discomfort or pain caused from the speculum by relaxing. It is important to tell your healthcare provider if you feel any pain or discomfort. The cervix will be numbed with a local anesthetic such as lidocaine. After the cervix has been numbed, it is dilated or made wider with special instruments. When the cervix is wide enough, a scope is inserted into the uterus. Fluid will be moved through the scope into the uterus. This makes it easier for your healthcare provider to examine the uterus. You may feel this liquid dripping out as it drains. During this procedure, your healthcare provider will look at the uterus and the openings of the fallopian tubes. If the healthcare provider finds polyps and abnormal-looking tissues, they can be taken out with special instruments inserted through the scope. If a uterine septum is found, the tissue can be removed. If needed, your healthcare provider may take a sample of the inner lining to check for cancer cells. If after the hysteroscopy your healthcare provider is unable to find and treat the reason for your bleeding problem, he or she will start the HTA. First, the anesthesiologist will administer general anesthesia. The procedure will use the scope, a special computer-controlled pump, and a water heater. During an HTA, hot water is flushed into the uterus for 10 minutes. This causes the destruction of the endometrium. The water pressure is closely monitored. If there is any change in water pressure, the water is immediately sucked out. Because of this, water stays in the uterus and does not go into the fallopian tubes or the abdomen. After 10 minutes, the water is drained out. The hysteroscope is then removed. Risks and complications. This procedure is very safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia, those related to any type of surgery, risks specific to this procedure. Risks of general anesthesia include nausea, vomiting, problems with urination, cut lips. Other risks of general anesthesia include chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen. These usually show up a few days after surgery. They cause the leg to swell and hurt. These blood clots can come loose from the leg and go to the lungs, where they can cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is important to let your healthcare provider know if any of these symptoms happen. Walking shortly after surgery helps to decrease the risk of blood clots in the legs. Some risks, such as infection and bleeding, are seen in any type of surgery. Other risks and complications are related specifically to hysteroscopy and HTA. These risks are rare, but it is important to know about them. Because of the way the legs are positioned in the stirrups, a nerve near the knee can be placed under tension, resulting in some leg weakness and numbness. Rarely, structures in the pelvis and abdomen can be injured during the procedure, especially if there is a lot of scarring from previous surgeries. The uterus and fallopian tubes can be injured, requiring another operation to fix the injury. In rare cases, the intestines and blood vessels could also be affected, requiring another operation. Even though highly unlikely, the fluid used in HTA may leak into the abdomen or in the vagina, causing burns and scarring. It is rare for the bladder and the tubes connecting the kidneys to the bladder to be injured, but if this does happen, another operation may be necessary and could result in the loss of a kidney. In rare situations, small nerves in the pelvis may be injured, resulting in decreased sensation in the sexual organs. This can lead to sexual dysfunction. Because this procedure aims at destroying the endometrium, future pregnancies are usually not possible. This is why this procedure is done only when the woman is sure that she does not want any more children. The ovaries are not affected during this procedure, so ovulation will still happen. If an egg is fertilized, it usually is unable to attach itself to what is left of the endometrium since most of it is gone. If a pregnancy happens after an HTA, it usually ends up in a miscarriage. Even though this operation makes it extremely unlikely for a woman to get pregnant, pregnancy is still possible. HTA does not protect against sexually transmitted diseases. HTA is generally a very successful procedure, but there is always the possibility that some patients may not be helped by this operation. After the procedure. After the procedure, you will be taken to a recovery ward where you will be allowed to recover from general anesthesia. A tube may be placed in your bladder to help empty urine. This tube is called a Foley catheter and will be removed before leaving the hospital. Some cramping and vaginal bleeding are expected after a hysteroscopy and an HTA. Over-the-counter medications and prescription drugs usually help with the cramps. Make sure to ask your healthcare provider which medication you should use. You should call your healthcare provider if bleeding becomes excessive or if you notice foul-smelling discharge. These may be signs of complications. You should also call your healthcare provider in cases of severe abdominal pain, fever, chills, leg pain, or any other unusual symptoms. You should not have sexual intercourse or put anything inside the vagina until your healthcare provider says it is okay to do so. You will need to take short walks to help blood circulate in your legs and prevent blood clots from forming. Most patients will not experience periods after this procedure. Other patients will have lighter and shorter periods.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Some women experience irregular or heavy menstrual bleeding. When bleeding is abnormal and your healthcare provider cannot treat it through other treatment options, she or he may suggest a hysteroscopy with an HTA. A hysteroscopy is a procedure where a scope is inserted into the uterus to diagnose and possibly treat uterine bleeding. If hysteroscopy cannot treat the cause of the uterine bleeding, the healthcare provider may perform an HTA. HTA is a procedure where heated water is flushed into the uterus to destroy its inner lining. This procedure reduces uterine bleeding and in some cases stops it altogether. HTA is a permanent procedure and pregnancy may not be possible afterwards. HTA is a safe and successful procedure. Like any other surgical procedure, hysteroscopy and HTA have certain risks. Knowing about them may help you detect and treat them early if they happen. Thank you for using Explain.